What things do I look for when I first enter the patient's room to make sure, everything is in line and the patient's going to be safe? So, first and foremost, I love to do bedside report for this reason. I know people they always come for me for bedside report, but technically, it is best practice. But besides that fact, I like to do all this when I'm in the patient's room doing bedside report or like right after report so we can make sure that we're making sure there's no unsafe situations. First thing I'll check is the patient's monitor. I like to go to their monitor and make sure all my alarms are turned on and my parameters are set correctly. So for example, if the patient has their blood pressure, let's say their blood pressure is like 120 over 70. I will make sure my alarm is set to alarm, maybe if the systolic drops below 90 or the MAP drops below 60, whatever is appropriate for that patient. A lot of times nurses will change the alarms when a patient maybe is a little more sick, maybe their blood pressure has been low for a while and we don't want it to keep alarming. So when the patient's in that kind of acute phase, they change the parameters, but we need to make sure we're adjusting these to the patient. We'll also make sure that I have an ambu bag in the room and that the suction is set up and ready and working. I will also check all of my patient's drips and medications to make sure nothing's going to run out, but I will actually go into the pump and look at how much volume is set left so I know, when to expect my bags to be running dry and give me enough time to request that medication from pharmacy or go get it from the Pyxis. I will also check all of my patients, lines, tubes, the patient positioning, just make sure that they're correctly in bed, that they're not going to pull anything. If they need restraints on, that their restraints are on appropriately, bed alarms turned on, even for vented patients. On my beds, we can change whether we want it to be, the patient bed alarms when they're out of bed, when they're exiting bed, when they're just moving in the bed. So depending on the patient situation, we can change the alarm. I will also, this is like not really a safety thing, but while I'm in the room initially, look at all the labels and, suction canisters, IV drips, like labels, and make sure nothing's going to be expiring. And if it is, then I kind of have that mental note of what I'm going to need to change throughout my shift. Also, the ventilator or BiPAP or whatever they're on, make sure that you're checking to make sure those alarms are on. At my hospital, our respiratory therapist usually does this, but it's important for us to get a second eyes on it as well. And that's it. Let me know if you have anything else.